Would you like to describe your experience in accessing uh, your medical services during the pandemic and the impact it's had on you?
Well, I'd like to say thank you very much for this opportunity this morning. If I can just give you a brief diagnosis of my condition and take you through the journey of the knee pain I've had through the pandemic. Basically, I'm waiting for knee replacements for both my knees. And I also have an underlying health issue. I have lymphedema in my legs, which I have actually contracted from previous surgery around about 7 years ago. So I've already got significant pain and swelling in my legs, also accompanied now by the fact that my knees have basically perished away as well. I basically started getting knee pain about 2 years ago. So I've kind of been on this journey for 2 years really, and I got referred on the NHS waiting list in October last year. I got notification in March of this year that I was going to have my first knee replacement done on the 17th of April. And unfortunately, that got cancelled towards the end of March. So in the meantime, I had to take early retirement because I was just in too much pain between the two conditions. And I was having difficulty really walking. So that came to a halt. I've kind of had to use the services, medical services during the pandemic of really my local GP, not so much my local hospital, until yesterday when I did actually contact them. So with regards to the local surgery, they've been absolutely marvellous. I've had 2 appointments during the pandemic, and I've also had a telephone consultation. And to be fair, I think they actually were working better during the pandemic than they were prior to it. I was absolutely amazed just how quick I got appointments, how quick I got through on the phone. Generally, I can't say anything bad about the actual doctor's surgery. However, with regards to my local hospital, a slightly different story there. The last I heard from them was in March when they phoned me with the bad news that my operation was being cancelled indefinitely. Heard nothing from them ever since. And in preparation for today, I thought yesterday, well, I'll give them a call, see if they can give me some idea of when I might be getting my surgery back. To my shock and horror, and I was given some pretty bad news yesterday, which has really put me in a bad place now. I've been told there is 0 chance of my first knee replacement being done this year. Pretty shocked at that, considering I had an operation date of 15th of April this year. And I find it hard to believe that even when things get back up and running again, that it's not going to be probably until next year before I have my first knee replacement. So I'm a little bit puzzled by that. I then actually explained I was in a lot of pain, and I was told that when it comes to surgery being reinstated, it would be done on a priority basis of urgent cases, and that if I felt I was an urgent case, I should go back to my GP and ask him to contact my consultant for me to be considered as an urgent case. In hearing that, I immediately did phone my surgery yesterday, and I was very lucky to actually get a call back in the afternoon from my doctor, who, when I explained all this, was absolutely horrified and quite angry about it, saying, this is ridiculous, this is not necessary, this is just wasting GP's time. You've already been referred to the consultant, he knows how bad you are, you already had an operation in place, you know, this is not necessary, and he is actually going to take this up himself with the consultant. I've continued to get worse pain-wise. Medication doesn't work for me whatsoever, so I'm getting nowhere. I've had the physical impact it's had on me is obviously ongoing pain on my knees, difficulty climbing stairs at home and anywhere else. Pain in walking, pain in sleeping, pain basically all the time. No medication that I've been on has helped me at all. I've also now got pain developing in my left ankle, which during the pandemic period, I've actually been to see my GP about it, and I'm waiting a blood test because there's a possibility I've now got arthritis in my ankle as well. Just turning to the emotional impact this has had on myself. My life basically feels very much on hold at the moment. It's really frustrating because it affects me. I'm frustrated, I'm anxious. I believe my social and my family life has been affected by this as well. It's having an impact on my mental health. It's the not knowing. It's like my whole life's on hold, and I'm just like getting worse, to be honest. I just really would like to get my life back again. That's kind of what I'm wanting. With regards to how things I think could have been dealt with better with all this, I think, to be honest, was it really necessary for every hospital to be closed to surgery, which I assume is what's happened? Could there not have been a small amount left open that could have continued surgery? Because there's obviously a massive backlog, let alone the backlog that we had before the pandemic, because I had already experienced a massive delay prior. So this is only now going to be far worse. I also would have liked to have got some updates from the hospital. I mean, there was nothing. There was no offer of pain management. There was nothing whatsoever. I had no updates at all, as I say, until I rang them yesterday. I've got concerns, to be honest, that my health is actually going to get worse before it gets better if the delays are going to be for much longer, because I know myself that, you know, things aren't right, and I have experienced the pain's got worse during the last couple of months. I very much want to say a great thank you to the charity, the Arthritis charity versus Arthritis, because they've helped me tremendously through the last 12 months. Without their help, I think I would have been in a worse place, to be honest. So their support's been fantastic. I just would like to end my statement really by saying I would very much like to get a true reflection, if possible, of what I'm expected to have in front of me now as a true delay period.